So that is where we get into a lot of gray area, right? Because there's no federal regulation around med spas. It does vary by state. And sometimes there's not even physician oversight. So there was recently a study done by ASDS, the American Society of Derm Surgeons, and only 38% of med spas have any physician supervision.
Hi, Skin Friend. Thanks so much for tuning into this week's episode of The Skin Reel. This week, I'm really excited to have my colleague on, board-certified dermatologist, Dr. Mansha Sethi. She practices in Pennsylvania, both cosmetic and surgical dermatology. She helps train the future dermatologists of the world, the dermatology residents, and really exciting that she has partnered with her hospital to create a medical spa or med spa that is actually run by dermatologists closely in collaboration with estheticians to really help give patients the best of both worlds, of both a med spa experience, but with the expertise of dermatologists. And I wanted Dr. Sethi to come on today to talk about med spas because they are everywhere. You cannot drive by a strip mall or even go to a party, it seems like nowadays, without someone offering some sort of cosmetic, aesthetic treatment. And it's really the wild, wild west out there. It's hard to know who's good, who's credentialed, is this treatment safe or not, and what to do when you do see complications. So we are going to dive into the sometimes complicated world of med spas and what a med spa really is and what it really is designed for. If you have ever thought about going to a med spa or you go to a med spa, you definitely want to check this out. Dr. Sethi, I'm so glad you're here to talk about something that I think is really important for listeners to understand. And that is this whole concept of med spas, because I feel like there's just such a gamut about what that really means. So thank you so much for being here.
Yeah, thank you for having me. I'm excited to talk about this topic as well.
Yeah, I feel like that term is thrown around so loosely, right? But what is a med spa? What is it?
So med spa is basically a comprehensive clinic where we're able to offer non-invasive cosmetic procedures. So it's anything from your Botox fillers, PRP for hair loss, to lasers. As dermatologists, we do lasers for a wide variety of skincare conditions. And we offer cool sculpting also for the fat. But yeah, it's basically one-stop shop for your non-surgical aesthetic needs.
Yeah, I feel like there could be, well, maybe not surgery, but certainly invasive procedures can be done at med spas, right? Like PRP, liposuction at some. So really, it's kind of like anything and everything potentially goes. I mean, I'm sure there is some surgery being done at med spas, wouldn't you say?
Oh, yeah, I'm sure. I know people do liposuction, like you said. Some people do blepharoplasties. You're right, though. Med spa is such a vague term because I know some places also do, like, the IV drips that are all the rage these days, or the semaglutide injections. It's a huge gamut of things.
Yeah. And who regulates what med spas are? Is that kind of the federal government? Does it vary state by state? Who's sort of overseeing med spas?
Yeah, so that is where we get into a lot of gray area, right? Because there's no federal regulation around med spas. It does vary by state. And sometimes there's not even physician oversight. So there was recently a study done by ASDS, the American Society of Derm Surgeons, and only 38% of med spas have any physician supervision, which is crazy, right?
That's crazy also because I know some med spas where there's a physician, but the physician is a radiologist or a psychiatrist or someone who does not do aesthetic medicine. And, they're using the MD, but they don't really have knowledge in the aesthetic space per se. So the fact that and even that is not even available in, what did you say, in 38%?
38% of physician supervision. So that could be remote supervision. That doesn't even mean that they're on site. And interestingly, they found that only 16% were plastic surgeons and 4% dermatologists. So our fields who do get trained in residency, there's such a small percentage of plastics and derms owning these or supervising.
And I wonder if it's because a lot of times our clinics are, med spas, if you will, right? But it is kind of crazy to think that how little supervision there is. It's like med spa is a medical, but also spa, right? But we sometimes forget the medical component of it. And you brought up a good point too. It's quite variable on what supervision entails, right? Because for some, the person doesn't even have to be on site. They could be in another state, right? They don't ever have to lay eyes on a patient. I call them patients, right? But I think at med spas are their clients, their customers, right? It definitely seems to have removed that patient-physician relationship, which can be a little, I think, scary because these are they're elective procedures, right? No one has to get it done. No one's going to be harmed if it doesn't happen. And then secondly, we know that there are complications or can be complications with any procedure, right? I mean, it's not like dermatologists and plastic surgeons don't have complications, but I think the important difference is when there is a complication, we know what to do and how to treat it.
Right. I 100% agree. I think because the med spas are being run as these more like non-clinical aesthetic centers, people are not calling them patients even though they are, right? And then to go back to your statement, who is managing these complications? If there's no physician on site, we as physicians, I'm sure you too, you get complications from other med spas and we manage them. And I often ask the patient, hey, like, did you notify the person who did the procedure? And a lot of my patients actually don't. They're so frustrated that they don't let the person who caused the complication know about it. So there's almost a lack of feedback going to these people performing these procedures.
Yeah, no, I'm totally with you there. I definitely have patients coming in saying, I have this done. Now I've got this scar, this hypopigmentation, this lightening of the skin. What do I do? And I'll tell you, I also get texts from colleagues trying to get me to help them get out of trouble when someone in the spa that they're overseeing has gotten a complication and they're looking for my advice, which I don't give because I am not involved in that care, but that happens a lot, which is kind of scary.
And, a lot of these things like Botox or whatever could be done by anybody, right? But you should be able to manage your complications. I personally don't perform any procedures where I don't feel comfortable managing the worst case scenario that could happen.
Yeah. And I think Botox, right? Like, what's the worst that happens? You get a droopy eyelid or some asymmetry, right? But that wears off. It's not permanent. It's not fun for a few months, but it's not going to be life-changing for someone. They're not going to love it right before their wedding, sure. But things like fillers, right? Like people have gone blind from having filler injected. I heard about a woman who had filler in her neck injected by a non-physician and it got into her carotid artery, which is just terrifying to me. These things aren't necessarily common. I don't want people thinking like, oh, these are super common things, but it just takes one to really, really scare you and freak you out. And I think as, everyone's seeing fillers and all these procedures on social media, more and more people are like, oh, I could do that. I could learn to do that. Or I know how to draw blood. I can do filler. But if you don't really know the anatomy and you don't have enough education to know what the complications could be, then you can run into real problems.
I agree. And what really scares me is the complications that happen with lasers that people take lightly, right? Like IPL, it's so common, the IPL photofacial, but you can cause some serious burns. You can cause hypo and hyperpigmentation, which honestly, like I have done it once myself and I lost so many like days of just being stressed out about it. The patient ended up being fine. We treated her. But it's just that even in the hands of a trained physicians, complications can happen and it's scary.
I'm glad you brought up IPL because that is something that's so, so common in med spas. I'm not totally anti med spas. I actually have gone to a med spa and I really trust this esthetician. She knows her limits, right? Like she knows what she can do and when things don't seem right. And she actually will text me pictures of concerning spots and she'll say, with the patient's permission, and she'll say, I don't like how this looks. I'm not going to treat you until you've seen Dr. Mina and she gives the A-OK, right? Like, I think that's actually excellent teamwork, right? Because I don't do necessarily the procedure she does, and anything she's worried about, she knows when to call for help. But yeah, for these IPL lasers, not really lasers though, right? You can really, really cause some harm if you treat, probably my skin, it's going to be okay. But someone like your skin color or darker could have some really serious complications with that don't always go away. So I think people have a false sense of security that these things are safe because we're not cutting the skin. There's not blood necessarily. And they think, oh, it doesn't even hurt. All you have to do is hit a button. So I think there's this false sense that you can't also have complications and side effects.
And a lot of these lasers like IPL treat pigmented spots, right? So you want to make sure they're not skin cancers that you're missing or lasering. And that needs to be checked out. And you're right. Like, I'm not against med spas, obviously. Like, I work at one, we started one. Med spas have their place and they are very beneficial and helpful for patients. It's just, like you said, knowing your limits and knowing what to treat and when to treat it.
I've seen so many because I do a lot of Mohs surgery. I can't tell you at least 10, if not more, melanomas that were lasered by people who are non-dermatologists, right? Who just didn't realize that that pigmented spot that was totally flat and kept coming back and didn't respond was actually a melanoma. And that's scary. So that's why I do think it's helpful to have, if not a dermatologist, a physician at least doing that first consultation and then being able to send you to someone well trained for your microneedling or your dermaplaning or firing the laser. The firing of the laser is not the complicated part, right? It's the settings. And again, a lot of these laser companies, they want to make it as easy as possible. And so they have a lot of pre-programmed settings, right? Where you just plug in the person's skin type and a few little parameters, their age, and then they spit out the numbers. But you can't just rely, people aren't that black and white, right? Like you can't just rely on those settings and think you're going to be safe. And again, I think that's where people have this false sense of, oh, it's so easy. The computer tells you what to do, and I just follow that. I wouldn't want someone treating me for a cosmetic thing who only knew what settings to use because a computer program told them. They don't have an understanding of the, mechanisms.
Yeah. And I'm sure it's been your experience. Like, a lot of these presets are they're like safe settings, right? That the companies input that anyone can use. And oftentimes I have to increase them appropriately to get good results. So if you're just doing these presets, you're probably not even getting the ideal results for your patient. So you're right. You have to tweak it. You have to know the laser dynamics. You have to adjust it based on the patient's skin color. There's just so much that goes on that I'm sure is being ignored.
What do you think for someone, because med spas, they're here, right? Like they're not going away. And again, like I said, I've had IPL at a med spa, and I go to someone who knows her limits and knows her strengths and is very appropriate. But not everyone is like that, right? And they might think, oh, I went to a weekend course, now I can do these things. What do you advise for someone who wants to go get laser hair removal, right? Because a lot of dermatologists don't even have laser hair removal in their office because it's almost something that's been like taken over by med spas and seems to be something that's really done there. How do you know if you're going to a good one or not?
Yeah, so laser hair removal is ubiquitous. Like, every place almost offers it. The main thing with laser hair removal is to make sure that the laser they have is correct for your skin type and your skin color. Because laser hair removal is a very easy procedure when it goes right, but it can cause burns. I tell my patients, if I'm sending them to a med spa to get the laser hair removal done, I always tell them to ask the place what laser they have and to let me know so I can tell them if it's okay for their skin type. That's the one thing. And the second thing is, when you're getting the treatment and if you're feeling like too hot or too much pain, to let the person know to adjust the settings, because that could be a sign that you're getting a burn as they're doing it.
I will usually sometimes write out if I'm sending them somewhere which laser they need, which one to not have. Again, someone with like really pale skin like me, it's hard to make my skin whiter, but that's going to be totally different for someone who has a tan or has darker skin, and not every laser is appropriate for that. And yeah, I've seen some pretty horrific results of that. So yeah, it seems like, oh, laser hair removal, even they're even doing like at home devices, right? For that. But yeah, to your point too, when people are just following the pre programmed settings, you're going to be getting like the safest possible per the company. And so it may not be as effective, and you may have to go more often because again, they aren't necessarily tweaking it, understanding sort of the laser physics in your skin type.
Yeah, and even at our med spa, I don't do the laser hair because I do the more advanced lasers like the CO2 and the ablative ones. But we work with like an excellent esthetician who always runs her cases by us, the dermatologist, if she has any questions. And she knows her limits and she knows what she's treating. She's been doing it for years. Any questions, she always gets them screened by us. She even knows to call us to her room if patients have questions so we can, look at their skin, look at what she's doing is correct. So, like I said, if the relationship between a dermatologist and an esthetician is very open, then the med spas can work in a great way.
I agree. Absolutely. I think it's just making sure you have even maybe just that first consultation, right? Where you can really talk to someone who sort of understands the big picture. What are you trying to improve upon? That's the other thing I'll see with people who almost like price shop too, from different med spa to different med spa, looking for a deal, which you don't want a deal when it comes to cosmetics and aesthetics. Again, it's elective, right? And some of these places that have been doing fake Botox, right? Like if someone's offering you Botox for $6 a unit, you're not getting Botox. Like the math just doesn't math for the place to be able to buy that. So I would say don't shop around for the cheapest price. This isn't where you want to go necessarily get a deal. And I also find if you are constantly going to different places, your results are very piecemeal, especially if you're doing injectables like fillers. I find if you go see one person for lips, another person for temples or cheeks or whatever, it can look piecemeal because you don't have just one person looking at you sort of globally on what would work best.
I agree. And actually, now that you mention it, even just on Instagram, I get so many DMs about all these like fake Botox products of people trying to sell me, these like neuromodulators from, I don't even know their names. Like they're just like fake Botox, like you said. And it is cheaper. And it's like, yes, we know we're not buying them, but I'm sure there are people who are buying them because it increases their profit margins.
Well, and we had the outbreaks, right, of all these people getting sick and having to be hospitalized because of it. So we know people are doing it. So again, don't get the cheapest price out there, right? You want quality. Again, this is your aesthetic look. Yeah, your face 9 times out of 10. And yeah, definitely having complications is not what you're going for. So I couldn't agree more. That's crazy. You get those DMs.
Yeah, and it is interesting though, our med spa's been open for about 3, 4 months now, and I always ask the new patients how they heard of us, what brought them in. And a lot of times, it's people just Googling and looking what's closer to them. And my patients are honest with me, and a lot of times they will tell me that, they just go to a place if the price is cheap, and they don't necessarily always care that there's a physician doing it or even if there's a physician on site. Because a lot of people just go by cost, which is reasonable, right? But it's just, you do have to eventually think of the cost benefit ratio.
Yeah, you're not saving money if you have scarring or hospitalization. There were the reports, I think, a few years ago about people getting HIV from a med spa that wasn't handling the blood products from PRP.
I did read about that, which is you're never supposed to use it for more than a patient. So,
But that's scary because, yeah, that's a blood product. That's not just something you bought and opened a package of. That's from someone's blood. And you certainly don't want to be getting that mixed up. So, yeah, I mean, they're terrible that happened. Any kind of like major red flags for someone if they're at a med spa where if they see that, they need to like run out the door and never come back?
well, first, like you said, if the cost is too good to believe. right? Like that math doesn't add up. The second thing is if the places tend to be over promising, right? Like you can't treat, for example, scar treatments take like 4 to 6 to 8 treatments. If someone is promising you that they can treat your scar in 1 or 2 treatments, like, no, like run. That's not going to happen. You're just wasting your money. A lot of times there's treatments offered that I don't know what your opinion is on threadlets and stuff like that, but I just feel like it's overpromised that, you get these threads, you're going to be good for like a few years. But in reality, we don't see results last more than 6 to 9 months. And so I feel a lot of this overpromising is just very fake. And you should really question that and really ask a lot of questions of the provider who's doing this for you.
Right. Yeah. Don't be afraid. I think sometimes people are nervous. Well, I don't want to seem rude. I don't want to seem pushy. But if you're paying money for this, I think it's reasonable to say, ask them what their training is. What are they, a nurse? Are they a nurse practitioner, PA, physician? If they're a physician, what's their board specialty in? How many of these do they do? I think that's all totally appropriate. I mean, patients will ask me that more so when I was a younger dermatologist. I don't get those questions as often anymore. But yeah, and I don't take offense to it, right? I'm actually glad they're doing their due diligence about that. I would say another red flag would just be look at how it looks, right? Does it look dirty? Are there just random syringes, unlabeled, sitting around? Uncapped needles, just like stuff like that. If you see that it kind of looks like a mess and not really organized, doesn't look clean, people aren't using hand sanitizer, washing hands, things like that, I would be very concerned about going further and forward because again, some of these, even the lasers, right? You can have particles of skin that come off and are spread and blood. So it's not like these are totally risk-free procedures.
And going back to your point, like, yes, you should question who's doing it because a lot of times even the term doctor is kind of thrown around, right? Like, just because someone's a doctor doesn't mean they're an MD or a DO. There's other qualifications that also go by doctor. So don't be afraid to ask, like, especially this is a voluntary procedure. You're paying out of pocket, right? Just know who's doing it.
Are there any procedures that you think are maybe not safe to be done at a medical spa? Or do you think with the proper supervision, really anything goes?
I think that more involves surgeries, unless if it's a same day surgery center also associated with the med spa, that's different, right? Because certain procedures, I just wouldn't do it, right? Like sometimes we as dermatologists do like scar revisions, which, you often have to cut the scar and redo it and stitch it up again. So I feel like those kind of procedures are better done at a medical dermatology practice.
Yeah, with things that are maybe more invasive. I would say liposuction probably would be best done at a actual medical facility where also that the nurses, medical assistants, and the person doing it they do this a lot. They have the room set up. They have protocols and all that. I don't know. To me, liposuction seems like something that is more in line with doing at a medical practice or surgery center, in my opinion. And some of the lasers, there are some lasers that are more forgiving than others, but things like a CO2 laser can be really strong and can lead to some serious complications. For something like that, pretty intense, a good bit of downtime, I would recommend really seeing someone with a lot of expertise in that because I feel like the complications can be also quite severe.
Yeah, and the other thing is that you want to make sure if you're doing these more involved procedures that the med spa has somewhere where the instruments are getting sterilized. We are associated with the big hospital network, so all our instruments go through the hospital to get sterilized, and we get those back. But if you are just a standalone med spa and you're not sterilizing, like that can get very tricky. You can get infections like bacterial, fungal, viral. That's important to note as well.
Absolutely, right? Even the nail salons are autoclaving and sterilizing, right? So there definitely should be doing that at the med spa as well. What do you think are some of the best med spa treatments that someone can get that are slam dunk? Yeah, definitely go to your local med spa. These are great procedures for med spas.
Yeah, so I really like hydrofacials or diamond glow facials, right? Like those are more involved than a regular facial because a machine is used, but those are like I think it's a great resource that med spas offer. lasers that are more easier to do, like, for example, laser hair removal, in the right patient if the right laser is used, or the Moxie laser, which is a non-ablative, also with less complications as long as you know your settings. Those are good procedures. Skin pen or micro needling, that's another good one. Dermaplaning, stuff like that. So I think of a med spa that is not physician run at all as more like a wellness place, where you're going and you're getting these relaxing treatments, not necessarily the more invasive ones like CO2 laser.
I totally agree. I think of it as like a nice afternoon refresh and you relax and beautiful music. Maybe you get a massage or a facial massage or a facial. You could talk with someone about skincare, things like that, but more spa than medical, right? And like leaving the bigger surgeries or the more intense lasers really to someone with a lot of expertise with that. So I totally agree. And I think there absolutely is a place for medical spas when done with the right supervision, the right training. And it just seems like it's gotten a little bit like the wild, wild west right now, where anyone and everyone can open a med spa, buy these products, inject them, whether you are a healthcare professional or not, whether you're a physician in one of the core four aesthetic fields or not, right? And it just can get kind of crazy. And some states have such lack of oversight that it really requires patients to do their due diligence to make sure that they're staying safe. And I think the other clue would be if, go to a med spa that makes you feel good, you relax, but if they're always pushing you to buy more, buy this, buy that, you may want to just take a step back and kind of reassess too, that you may not need all those things that they're pushing.
Yeah, that's definitely a red flag. Actually, when I lived in Texas for 2 years, there was a hair salon by where we lived in Houston that did these injectables, that did Botox and fillers. And it would just shock me because it was a hair salon that was just offering this on the side.
I feel like that's really common. Like, that doesn't even surprise me.
Not anymore. But the first time I drove past it, I was like, what is happening?
I know. I feel like we'll see him at the grocery store next, right? Like these drive up injectable clinics. So I think it's just important to remember the medical in med spa, right? That some of the stuff being done really are medical procedures, and we really need to treat them as such and just make sure, again, like patient safety is number one, two, and three. And yeah, for people listening too, don't just go by your best friend's review or whoever's got the most Yelp reviews, right? Or the cheapest price. Like, ask around and your dermatologist may be able to help guide you, right? Like I'm even today referred someone to my esthetician, Ronka, shout out to Ronka, because I don't offer what they needed. And I knew they'd be a good candidate for this. And she's my girl. So again, I think that collaboration, that partnership is really important.
I could not do the work I do without an esthetician. Like, she does so much for us. And we both kind of bounce off each other and we refer patients back and forth. And I think the collaboration works really well.
Yeah, we have a young woman in our office who just got her esthetician and laser license, and she loves to talk about skincare, and she's got a lot more time to really delve into skincare with patients, and they love it, and they love being able to talk with her and ask questions, and she knows where her zone of genius is, and it certainly doesn't take away what your dermatologist offers, but really it can actually amplify that. So, Dr. Sethi, this is great. I love that you have a med spa that is run by dermatologists, right? And that you partner with your esthetician and the providers in the practice to really give top notch cosmetic aesthetic care. So I just think that's wonderful. Can you send us off with like your top three pearls for someone who is thinking about going to a med spa and just wants to make sure that they're staying safe?
Yeah. So the first thing would be definitely find out if there's a physician there and what their training is, right? If they're plastics, derm, or if they're psychiatrists, because that can happen too. So find out who is supervising. The second thing would be always find out what they're offering. Like if a med spa suggests a laser specific treatment, don't be afraid to run it by your dermatologist and just ask your dermatologist, hey, this is what was suggested. Are you okay with it? And my third thing would be to just look around, make sure you feel safe there, you feel that it's hygienic, and don't do it just because someone is pushing a treatment on you. Make sure you feel 100% comfortable.
That's like good info just for life, right? Not just at the med spa, really anywhere, right? So great advice. I love that. I know you've got a great social media presence and put out some really great educational information. I know people are going to want to find you and follow you. Where is the best place for them to do that?
So my Instagram handle is Dr. Sethi, It's the same handle on TikTok as well, so they can find me on there.
Amazing. Well, I will include all of that in the show notes, and I appreciate you being here, and we'll see everyone next week.